Okay. Ooh.
Good afternoon, good evening, everyone. My name is Dr. Chanel James. I am the owner of Limbs and Things mobile and telehealth practice in DC, Maryland, and in Virginia. We are on Pull Up with Limbs and Things tonight with Nurse Doria Musaga, and she is with the BEMER group. And we're going to talk a little bit about BEMER and all the benefits that it provides for aging adults. So, I first met Nurse Doria at a Walks meeting, and she was talking about the Beamer and sharing all the information and the benefits that it could provide. And then we had a one-on-one conversation, and you told me all about how physical therapists tend to not think that the Beamer is beneficial. You think I don't remember that
I know.
conversation?
Did
And
I
so
say
I
that?
said, I'm going to prove you wrong. I want to hear about it. I want to learn all the benefits and see if it's something that'll be beneficial to limbs and things. And so tonight you're with us because I've actually tried it and you showed me that there are some benefits even for me. I have had increased energy, improvement in my circulation, better sleep, even improvements in my skin. And so I think it is very beneficial for not only my body, but for you all as well. And so tonight we're talking to Nurse Doria Musaga, who is going to share a little bit about her background as a nurse and how she got into BEMER. Welcome.
Hi, Dr. James. I tell you, you shouldn't have said that, but I think I did say that. I don't remember saying it, but there we go. There we go. You proved me wrong. Um,
Hmm.
Thank you so much for inviting me to this
Sure.
presentation. I absolutely look forward to talking to your audience. And you said to talk about older people, and I thought, oh, is she talking to me because I'm one of them? So it's right up my alley. It's absolutely right up my alley. I went to nursing school many years ago back in Cameroon before
Hmm.
coming to the United States, and then went to nursing school here in the United States, practiced nursing in a DC hospital for more than 30 years, and then started a home care agency for seniors. And so it's in my blood almost, talking about senior care, taking care of older people.
Hmm.
I want to say, and again, thank you so much for just giving me this platform to talk to anybody who would listen and those who would listen later on about the BEMER. But my goal tonight is just to tell anybody who listens, just educate you on aging and what you can do to help yourself. Because what's the use of getting older if you don't have good health? No good.
Exactly.
Uh,
Hmm.
we all look in the mirror every day and ooh, a little line here, a little there, and you wake up and you don't feel the same as you did yesterday. You don't feel the same as you did 10 years ago.
Hmm.
You're really young, so you really don't know what I'm talking about. But I tell
I
you,
do a little bit.
I tell you. And then today's environment is so stressful that even if each week is like a month, so
Hmm.
the stress really gets to us. So basically, what I'm trying to do is to tell you how how we can delay that aging process. We're going to get old, that's for sure. But how can we help ourselves so that
So
we
if
don't?
you're watching us, hashtag live. If you are watching on the replay, you can hashtag replay. If you have a question or a comment as we're talking, please put it in the chat and we will discuss it. Okay, I'm sorry. Go right ahead.
No problem. So my goal today is to show one way. It doesn't cover everything. Healthcare is not just one thing does everything. Taking care of yourself so that you age beautifully is not just one thing that you do. It's it's a whole circle of things that you do. One of the things that I'm going to talk about today is your circulation. We know that the heart pumps. I mean, if you ask physicians, medical people, they think about circulation, the heart.
Hmm.
The heart is the main thing that gets the blood into your tissues, into your around your body. But the heart has helpers, and what are these helpers? The microcirculation. 5 liters of your blood goes around all day long, but most of it, 74% of the blood in your body at any given time is in the tissues, in the small blood vessels, the microcirculation, the capillaries. That's where really the action takes place, where you remove the waste products from your body. So first of all, you take medications for this, for that, for that. You eat, you take vitamins, they're absorbed better because your microcirculation is functioning well, and you remove the waste products from your body. When you exercise, the lactic acid, it's all removed. So if you have a good and functioning microcirculation, that's where the action is. The heart is that big pump. We all know about it. But very few people know about the fact that your microcirculation, that 74% of the blood in your body, is where everything happens. That's
Right.
where
So how can you tell if it's not working properly?
you have so many things go wrong. Your sleep is disturbed,
Mhm.
there's sleep disturbances, you're foggy, the
Mhm.
eyesight, uh, the circulation, you have cold feet. Those are just some of the things that really are a result of poor circulation.
Yeah.
Cold feet, a whole bunch of other things. You don't absorb your nutrients well. So you take medication and it's not absorbed. So they increase the dose and the side effects are getting worse
Mm.
because you're not
Cycle.
absorbing all the medication. Yes, so it's a vicious cycle that starts
Mhm.
right there. You know, you get foggy, your balance, your muscles, they don't act as good. And as you get older, people fall because their muscle strength is weak. You, as a physical therapist, you see a lot of people who fall, break something, and they end up in your care because they now have to go to rehab. They have to go to PT. They
Mhm.
end up in your place. So
Right.
all.
I also see people who have just swollen limbs,
Mhm, mhm.
right? And they think
Yes,
that, oh, I'm just not moving enough, but it could also be internal with your circulation.
poor circulation, poor microcirculation, poor microcirculation. And so this is where this device comes in. It goes in, it works on the microcirculation, on the 74% of the blood that's in your body.
Mhm.
When you go to see a cardiologist, I forgot to say, I worked in different areas of the hospital over the 30 some years that I was a registered nurse. I
Mhm.
ended up in cardiology. When you come in, boom, they look at your heart, do that angiogram, look at those big blood vessels, boom, boom, boom. Most of the time, nobody, they hardly ever, the small blood vessels that are like less than a hair's breadth,
Mhm.
those don't get looked at as much, or hardly at all, because the that machine that looks at it is $1 million machine, and you can find that just about everywhere. So those don't get tested as much,
Mhm.
and that's how people end up on medications for this, for that, for that, for things that really, if they would target that microcirculation, open up those small blood vessels, it would take care of some of these issues. So what the BEMER does is to work on those small blood vessels, open them up. Oxygen is so important, so important. We have a video that shows that, and in 2 minutes, it shows you what happens after you get on the BEMER mat.
Mhm.
It shows the blood flow. If a child runs around, their blood is flowing that fast, that's fast. As you get older, it begins to slow down, it begins to slow down, it begins to slow down. When you get on the BEMER, 2 to 3 minutes after you get on it, you see in the microcirculation, you see the blood flow. And as it flows, it opens up, the oxygen level goes up to about 30%. There are multiple studies that show the effect of the BEMER, multiple. You go into PubMed, which is the medical, thing,
Research.
and look, yes, research directory, and look up the BEMER. So there are hundreds of studies that show that. So the oxygen level goes up, and actually that video I was telling you about, it talks about when you're born, you breathe. I worked in maternity. That's where I started out. When a baby is born, That first breath is the most they breathe and then wow, everybody's happy because now that is the first point. And when you die, you stop breathing. So that oxygen, so beginning and the end, so that oxygen thing, that is really where this thing has an effect. And so it works on every part, every part of your body, your eye, every part that has small blood vessels. And the small blood vessels are everywhere. We're talking about your eyes, your ears, everywhere. And so you talked about swelling. Swelling is some of the lymphatic system. That's all part of that system.
Right.
Yeah.
So you have a question here. So the BEMER increases the circulation of the blood in the body. Is that correct?
When you say increases circulation, it actually does in the sense that it works on the capillaries, and the capillaries are actually the pumps that push the blood back to the heart.
Yeah.
Without those little things, the heart by itself will not do all that work. Have you seen runners, people who run, they run marathons, they do this, and then boom, crash and, you know, kick the bucket because the micro small blood vessels, and more and more people are beginning to understand the importance of the microcirculation. For a long time, it was just the heart. You know, you go in, they do your angiogram, look at the widowmaker and the those big arteries that surround the
Mhm.
heart. More and more, we're putting some beginning to look at the small blood vessels in the liver, in the liver, in the pancreas, in the stomach, in the tissues, in your skin, where those tiny blood vessels are. That's where the action is. Yes. So in that sense, yes, it does increase the circulation. It helps the circulation.
Gotcha. Another question. Do you feel a difference on the first round of having a BEMER treatment? For me, I
That
can
is
answer
a
that.
okay. You go
Yeah,
ahead. You tell us your
I
experience.
did. I felt an increase in energy as soon as I got up from the BEMER treatment. It's only, I don't know if we've discussed it, I don't think we have. It's 8 minutes on the BEMER twice a day.
You use it 8 minutes twice a day.
Mhm.
And that the caveat there is that the athletes, the horses, we use it on horses. It has we don't give presentations to horses, but we put it on horses, and they absolutely behave the way you expect them to behave um, after that session. But you never give them a presentation. But
Mhm.
yes, but for normal home use, 8 minutes twice a day. That's it. Just lay on the mat. So it's almost like helping you physical therapy. We tell you to go out, do your exercises, do things. This is exercise for your small blood vessels. But
Mhm.
the question was the first round, and it's a question we get all day long. I do a lot of health fairs, and I set up my BEMER chair. People come and get, and most people, oh, I don't feel anything. There are people who feel it, like you did.
Mhm.
um, you had your parents there, they didn't really feel it. My mother, when I got my mother on there, oh my gosh, she said, we have to get this thing, we have to get this thing. I didn't feel anything. When I got up, I did feel some decrease in discomfort in my knee over which she
Mhm.
put the thing. But for the most part, you don't. Because right now, the blood is just, it's going around in your body, but you don't feel it.
Right.
You don't feel it. The reason I felt anything was because of the discomfort in my knee.
Mhm.
And again, when I got this BEMER, when I met somebody somewhere and she put my mother and I on the BEMER and we decided to get it, it was just to use it at home. My mother will give a testimonial that is half an hour long. She doesn't know testimonials are supposed to be 30 seconds, not half an hour. So
Mhm.
um, we brought it home. She's in close to her 90s. Before COVID, she would walk a mile to the store, a mile back. And the people say, "Oh, you're walking. Should we give you a ride?" They stop and I said, "Don't jump in people's cars. Don't get a ride from anybody that you don't know." But they look at her and they think, "Oh, we should give her a ride." She was walking 2 miles at least a day, two
Mhm.
miles. So that's how much. But I'll tell you what happened with me. My experience with it was that I came in, we get used to being told when you get older, we should be talking about older people. When you get older, everything should start failing. You should do less, you should not do this and you should not do that. And I kind of accepted that. We accept that. The new norm is no, not to accept that.
Mhm.
Because I will tell you, in the BEMER group, there's lots and lots of, most of us are older people, really. Most of the people who sell a BEMER are older people,
Mhm.
because we got in there to help ourselves and then we find out that it's working. How are you not going to tell your friends about this? So
Exactly.
I got there. I was seeing physical therapy 30 some years ago for my knees because I used to do high impact aerobics. I'm
Mhm.
close to 70 now. I'm almost 70 in a month or two. But
Nice.
my knees were bad. They were just shot. I swear now, I can walk around. I don't even know I used to have knee pain. I'm sorry, I didn't mean to say that, but knee discomfort. We're not supposed to say pain. The FDA doesn't want us to say that. But
Mhm.
yeah, knee discomfort. But that's how, I mean, without taking medication. So this is something that will help you without you taking any extra pills.
Mhm.
That's good for your other parts of your body, which I'm not going to start naming now. How long does the impact of the BEMER last? Okay.
Mhm.
It's supposed, they say twice a day, so it should last 12 hours. But the more you use it, it builds up. So after about 5 days of using it, it doesn't go back down to zero. It doesn't it doesn't go back down to zero. Um, it actually stays up. And their studies, we looked at different machines, different PMF devices, and looked at they measured the impact, like the oxygen level, the other things that they measure for to see how effective it is. And the BEMER just stayed up. After the second day, it just stayed up. It stayed up.
Mhm.
It doesn't go back down to zero. This device has been used in Europe for over 20 years. It's in the US. It's not that long, but it's that's why they have so many studies. That's why they
Gotcha.
have so many studies. Yeah.
What if you do more than the 16 minutes a day?
You can. And that's why I said you can do more than 16 minutes. But a lot of men, when they come to me for the first time, oh, just hit me up. And I tell you, they say at a health fair or the first time, I think you remember when you brought your parents, I said we
Yeah.
start at intensity one.
Mhm.
The very first time, just to see what your reaction. You give you some water, you drink, hydrate, and you drink after the session because you would go out. It does detoxify. So we put you on a low intensity, and men always say, "Oh no, I can take it. I can take it." No, we don't do it. You start at a low intensity one,
Mhm.
and then we go up to 2 to 3 for a week and just see, monitor it. There's certain conditions where you can do in more than 16 minutes. Lots of conditions where you can do more than 16 minutes. The athletes do more than 16 minutes, but an athlete and most people my age are not in the same physical shape. We don't need
Mhm.
to do that. We don't need to do that. And so for most people, you go up to intensity 6, you don't even go up to 10. You can go up to 10 with a local applicator, because they're local applicators. If I walked out the door here, fell, and sprained something, which has happened because I joined a gym, a boot camp with
Yeah.
people younger, much younger than I didn't know that. I didn't know that, who could be my children or grandchildren. And that young lady worked us. It was a 6 week boot camp. And
Mhm.
one day she said, Doria, wow, you're doing them push ups. You're doing those push ups. And I said, yeah, yeah. She was surprised. She was surprised that
Mhm.
I could do those push-ups. But anyway, I happened to sprain that back thing here that goes down my leg. And I limped home. I limped home. Could barely
Mm.
walk home. Came, put the local applicator on it a few times a day. Boot camp was usually 8 o'clock in the morning. So I put it on several times. This is not the mat, which you're using twice a day only, but the local applicator to a hurt, to an injury or something, I put it about 3 times a day. The next day I forgot totally that I wasn't able to walk home.
Mhm.
I mean, I forgot. I mean, it just So your circulation is so important, and that's the education we have to do. Tell people if you sprain your whatever you hurt, eh, that blood supply does the work for you.
So let's talk about what the beamer is actually doing. It's an
Uh,
electromagnetic field, right? You don't feel
yes,
anything when you're on it.
no, no. There are people who are very, very sensitive to any kind of energy. Yeah, they would feel it.
Mhm.
There are people who use the BEMER up to intensity 3, never even go above 3. So you listen to your body. Everybody who gets it from me, I give them a log. Just
Mhm.
record everything. I think I sent you by text
Yes.
there. Yeah, a sheet where I have a lady a few doors down. I mean, you should look at her book. My God. I said, whoa, we should publish this book. She writes down everything, how she feels, and then we're tweaking it. Do we go up in intensity? Do we go down? And do we do what? But yeah. Um, you base that on that, and so it sends an energy into your body. The energy is the same as what you have in the earth's surface. So if you're walking barefoot, I don't know if you've heard them tell you to walk barefoot a few times a day or something, so you can get that magnetic energy. It's the same thing, so it's a very, very safe energy. It's a very
Okay.
safe energy. Yeah.
Here's another question. What does the beamer do for arthritis?
We don't say it cures, we don't say it cures or any disease. We do not, because it's an FDA class 2 cleared device.
Mhm.
So our language, we watch our language very, very carefully. I'll
Okay.
tell you what it does. And my mother, me, I like I said, I abused my knees in my 20s. That was good, almost 50 years ago. So I abused my knees, so they need help. What it does, it brings the blood supply. It opens up the blood supply, brings nutrients to that part. So arthritis, which is the word he used, we would say
Mhm.
joint discomfort, joint something. We wouldn't use arthritis because we are not doctors. We're not I'm not a physician. I'm not your doctor. I'm not trying to cure or write a prescription for you.
Mhm.
You would still do what you need to do. Put the local applicator on that part where the discomfort is and see what the difference is. So when people go in and have surgery, hip replacement, that kind of thing, there's studies that show that you heal in half the time only because of that circulation that is so improved.
Now I've seen that. That's very true. In terms of people
Yes, yeah,
who
yeah,
have had a replacement, the
right,
amount of discomfort is
right,
significantly lowered so that they are able to go up and down stairs. Their precautions are not held for the same length of time. They're able to regain their normalcy much faster than those who don't use it.
right. And you don't have to take all the pain medications that
That
you
too.
would normally be taking. Take half the dose or not. Just all around, it helps. It helps. Yeah.
Hmm. Okay, I know we kind of answered this, but before we talk about that, because you've talked about the local applicator, there's a circular device that's like the
Hmm.
local applicator. There's a pad that you can lay on.
Right, the
There's a
belt.
belt
Hmm.
that you can put in a specific area, and then
Yes.
there's also
The
one that you
mat.
can sit on. Right.
The Oh, that's a sit. Yeah, be sit.
Right.
So if you work in an office 8 hours a day and you're sitting all day, sit on it, and it's you. So you don't get up. When you get up from there, the blood hasn't pooled in your legs or something like that.
Hmm.
Or you travel, go overseas and have a 9-hour flight.
Right.
You get there and you get out of the plane and you walk around, you know, without
Hmm.
an issue. So yeah.
Okay. We've got a couple of other questions here. I just want to make sure we answer them. How long should I sit? Sorry, how long should it last if you don't have Beamer treatment daily?
Which does happen because I do sessions, and some people cannot come every day. It just depends on what we're trying to do. If you have an acute injury, acute something just happened, I would say
Hmm.
yes, we need to do every day until that later. And again, you cut down the time where you're supposed to be having the BEMER sessions. But it, like I said, it should last at least 12 hours, at least 12 hours. And the more you use it, the more the intensity, the level stays up. So it never really goes back down. So it just depends. It just depends on what we're trying to do.
Okay. And then a follow up to that is, will daily treatments eventually heal aches in the body? We
Without
can't
a
say
doubt.
that, right?
Without, we shouldn't, but it, yes, but it does. Yes. Yeah. It doesn't heal. We're not, the FDA doesn't like us to say things like that. Yeah. But yes, yes, you will tell the difference. And that's why last month we just finished our um, Make a Difference challenge. What were we trying to do? And we're giving 5 free sessions to everybody. Everybody who wanted, you got 5 free sessions. And
Nice.
yeah, yeah, we just finished that challenge. And I can still do it if somebody wants it.
Okay. And
Yeah.
then here's another question: is the Beamer local applicator commercially available?
You can only get it from a BEMER distributor.
And you are one.
I am one, yes. And some medical practices now have them in their offices. They have like a bunch of machines and people just come and get on them.
Mm-hmm. Okay. There's another question here. What we all want to know: is Beamer treatment covered by insurance?
That is that every day we get that question every day. No, that's the short answer. But if you
Mhm.
have a practice, if you're a chiropractor, you're internal medicine, there are physicians who can work it into their something. I am not. I'm not. So I cannot. There are people who've used it with me with their, the plan where you put some money on your job, you put some money aside.
FSA accounts. Uh huh.
Yeah, that plan they can use it for that. But
Right.
just general, it does. We don't have a ICD-9 code yet. I don't
Right.
think. Right.
Mm-mm. Yep.
Yeah.
We do offer the Beamer session under a wellness uh, offering for
There
limbs and
you
things as
there
well.
you go. There you go. Yeah.
Okay, so here's another one. It's pretty interesting. What's the purpose for the Beamer having different intensity levels?
When you start it's the micro Tesla. It starts at 3.5 micro Tesla.
Okay.
Intensity 2 is 7. And by the time you get to intensity 10, it's 3.5 times 10 micro
Mm-hmm.
Tesla. And so it's a stronger, much, much stronger intensity. The athletes, the Olympic athletes, the football
Mm-hmm.
players, they can use it on intensity 10 for 20 minutes after a game because they have so much lactic acid built up in their system. They've been using this thing. They're much stronger. They're in much better shape than we are. And they do that. We just had the Ram race across America recently in June,
Mm-hmm.
from California to Annapolis, Maryland. If you look on
Oh, that's a
Facebook,
long way.
yes, yes. The BEMER team, the team whose bicycle riders had the BEMER, came in 1 day and 5 hours before the team after them.
Wow.
Yeah. And they've done this. We didn't do the past 2 years, but the year before they also came in first. That tells you it just it improves your recovery from exercise. So if you go exercise like I did, and I came back and I did that thing, the next day I could have gone to boot camp and just performed like I'm not an Olympic athlete by any stretch of the imagination, but it washes out. Lactic acid is when it builds up in your muscle. That's what causes a muscle pain. And oh, it takes
Exactly.
24 to 48 hours to get it out. No, 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 no. Get on your doggone beamer and wash it out.
Speaking
You know?
of, I was
Yeah.
just about to say that I have seen the benefits of that because in physical therapy, we always talk about delayed onset muscle soreness, which you just described as the 24 to 48 hours after you've done exercise, what you will feel after is being a normal reaction. And so
Right.
I went and did some exercise, but I got on the beamer right after, and I did not have that delayed onset
There
muscle
you
soreness
go.
after.
There you
So
go. There you go. I
Here's
remember
another question. Oh, go
yeah,
ahead. I'm sorry. Go
the
ahead.
first day after you got your BEMER, you got it that night, and I said, okay, do intensity one, and you got on it, and the next morning, ding, my phone goes up off at about, and you said, I have to tell you this, I have to share this. I slept for the first time in how old is your son? He said, normally you are up and waking everybody up,
Right,
and
right.
they had to wake you up. That
Exactly.
so sleep, recovery, all of those things help decrease stress.
Hmm.
I tell you, this and without side effects, without side effects.
Right.
Can
So
ask
let's
them.
answer this one. Does it matter whether you use the mat or the belt for a specific body ache, and what would you recommend?
The mat is for whole body because you lay on
Hmm.
it. The intensity in that is made to be lower, so it goes more into the tissues, the outside tissues. The belt, which I shouldn't call it a belt, and I've done for so many years. I've had it for so many. The pad, the pad or the spot has a higher intensity built in because it goes deeper into the tissue, into the bone.
Hmm.
The mat itself is made for more superficial. The belt and the spot go deeper into the tissues. So that's the
Very good.
difference. Hmm.
Okay. Can you treat thinning hair with the BEMER?
I'll tell you what, prior to 2019, um, when the FDA, we had the light.
Hmm.
It's a B light, which is like a spot, and yes, people used it for that. So and it's a cosmetic device to tell you the truth. Take the wrinkles out and use it for your wrinkles. I'm a dark skinned person. I don't worry about wrinkles. I just, I don't mean anything. I'm sorry. I didn't mean to say that, but
That's quite all
I
right.
don't,
I
I,
understand.
I don't worry about. I don't really don't worry. But yes, short answer to that, we did. So currently, the light, the FDA moved us from class one to class two. The light is still being worked on.
Okay.
So once we get the light through, and I have several lights because I've had my beamers for years, so I have the light device. But yes, you can use it for thinning hair. Absolutely. There are testimonials on that about
You
that.
got to
And
tell the story about your eyesight.
my eyesight, oh gosh, I tell you, when I first got my beamer, I
Hmm.
didn't, I mean, I just used it, I'd use it here, use it there. But 2 years after I got it, I went to get my eyes checked because you should go every year or every two. But nurses, they don't do what they're supposed to do. So it was
I think
more
that's
than
all
2 weeks.
healthcare professionals.
I get. And he said, "Oh, you don't need." I said, "Where am I?" He had told me I would need my glasses. Whatever they do to them. He said, "You don't need glasses." I said, "Are you sure?" And I didn't think about the beamer. I did not think about. I didn't until I went to one of our calls and somebody talked about how it had helped their eyes. I said, "Oh my God!" I said, "Whoa, that's what it was." Never thought of it. So at this, I don't wear glasses. I read everything that's going through. It's it's but that's I said, whoa, whoa, and that's why I go on the calls anymore because sometimes you forget or you don't remember things, and that's why I give people a shit. I said, please fill this out because you forget
Hmm.
that you were hurting here and you don't hurt anymore, or you're
Right.
walking down the street and somebody says you used to limp around. What happened? And then
Mm.
you say, whoa, whoa, I guess it's the beamer. So, you don't think about it.
Right. Well, let me see if there are any other questions. I don't see any. Thank you all so much for watching and giving your input, asking questions. I think the Beamer has been beneficial not only to me and my family, but also to those patients who I've used it with as well. And I want to make sure that you know that it is a service offering of Limbs and Things. If you are thinking it and you're thinking about this device and how it can help you, you definitely want to make sure that you get approval from your physician. There are some conditions that would make it maybe not advantageous for you to do. And so we just want to make sure that there's no risk to your current health situation.
Right. Right.
Are there any final thoughts you have for us?
I want to say, remember that this is part of a whole circle of keeping you healthy. So
Hmm.
just having the BEMER doesn't mean you now go out there and do not exercise, not eat right, just
Right.
sit in front of the TV. All I mean, you still have to do those things. It just makes it work better. And so you age less, boom, 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 you know, you
Exactly.
age slower. Yes,
Hmm.
your years are better. So those years are much better years. You're happier.
If you would like to contact you, how should we get in touch with you?
Uh, my phone, I have my email address on here. I
Hmm.
can also give you my phone number if somebody wants it.
And
But
then if you would like to order it, there's your website, right?
yes, yes. But call me before you order it, please, and I'll walk you through. This is a German machine, and somehow their internet stuff. You did yours yourself. I've had a few people recently. They just and I'm saying, how you did it by yourself, and they did. But again, especially if you're my age, you need a little bit of help. So let me know especially if you want to try too.
Hmm.
You want to get some free sessions. Let me know.
Absolutely. Well, I thank you so much for sharing about the Beamer. I think it's important that more people know about it.
Yes, I think so too. Thank you so much. Thank you. I'm so glad that we met at Walks and that I said, oh, physical therapists usually just poo-poo it because, but you proved you said, nah,
Okay, so now you can't say that anymore,
no, I
right?
cannot. I cannot.
Oh,
I
very
cannot.
good. I
Yeah.
hope everyone watching that you have enjoyed this session. You've gotten something out of it. Pull up with limbs and things is to confirm something you know, challenge something you don't know, and give you an opportunity to share that information with someone else. We hope you guys have a wonderful Labor Day weekend. Take care.
Bye bye.
Bye.
Thank you. Bye.